Good morning, guys. Good morning, guys. This is Dr. T, and welcome to Clinical Medicine with Dr. T. Guys, I think it's like 7:15 in the morning, and I thought to myself, maybe I can just do schizoaffective before I go to work. So we're gonna run through it, guys. Schizoaffective disorder. Okay. Yes. Schizoaffective. So, guys, I would really advise you to know the criteria A, B, C, for each condition, A, B, C, D, whatever. So they are very important. They help you to remember stuff. So, like we said that. So this patient, schizoaffective. If we break down this term, schizo refers to some kind of psychosis, and affective refers to the mood. Remember when we talk about affect, just think it like that, and it refers to mood. So it means in this condition, you don't have only psychotic features. You don't have only that, but you have a mood component as well. So, remember, brief psychotic disorder, schizophrenia, those ones are very similar to each other. They're very similar. The only difference is the duration and other things, small things. But this one now, it's different from those three because it has got a mood component. So that's the first major difference. As much as it will also have some psychotic symptoms as well, but it will have a mood component. So that's the major difference between this and the other, and the other three. So, what's criteria A for schizoaffective? So criteria A is someone who comes in with criteria A of schizophrenia. So this patient comes in with criteria A of schizophrenia, but big plus, but with a major mood episode. Major mood episode. And this major mood episode can either be a depressive one, or it can be a manic one. We'll talk about that when we talk about specifiers. So this is criteria A for schizoaffective. So now, which means that you need to know what is, we've spoken about it, what is criteria A for schizophrenia. Like we said that patients who have got psychotic disorder, who've got psychotic symptoms, or who are psychotic, they share psychotic disorders. They share these symptoms. Like we said, they share delusions. They have hallucinations. That's why I said that if you know these symptoms, you just understand them. Psychotic disorders, they become simple. And then disorganized speech, disorganized behavior. Ne? Okay, so those are 4 symptom domains for psychotic disorders. Now we are told that in schizophrenia you need these symptoms. It can be 1, it can be 2, but strictly when you talk about schizophrenia, you need 2 or more of these symptoms. When I talk about schizophrenia, strictly you need a minimum of 2 of these symptoms. But now what is happening is that you've got 1 or 2 of these symptoms. By definition should be 2. So you should be having 2 of these symptoms to say that this is schizophrenia. this meets criteria A of schizophrenia, because we know that for schizophrenia you need what? You need a minimum of two of these symptoms, and we know that one of those two symptoms must either be a delusion or a hallucination or disorganized speech. So now when we come to schizoaffective, we are told that to diagnose schizoaffective you need criteria A of schizophrenia, which means that you need a minimum of two of these symptoms, and one of those symptoms should be either this or that. Ne? But on top of that, you must have a major mood episode. That's criteria A for schizoaffective. Now moving right along. Criterion B. So criterion B for schizoaffective. So while this patient is experiencing all of this, there should be a time whereby they've got 2 weeks of experiencing this major mood episode. Right? No. Sorry about this. I'm mistaking this with something else. So in criterion B, so for us to meet criterion B, we need 2 weeks of delusions or hallucinations, right? In the absence of mood symptoms, right? And I'll tell you why that is important. So criterion B, in order for us to meet criterion B, we must have 2 weeks whereby we either have delusions only or we have hallucinations only in the absence of mood symptoms. Because if you have active mood symptoms throughout the entire duration of the condition, you've got active mood symptoms with psychotic, these are psychotic symptoms, right? With psychotic symptoms at the same time, all the time, then it means that this is not schizoaffective. It could be a major depressive disorder with psychotic features, or it could be bipolar mood disorder with psychotic features. So that's why you must have about 2 weeks or more during the duration of the illness, 2 weeks or more, whereby you only have delusions or hallucinations without mood symptoms, right? It's very, very important, guys. Otherwise, like I'm saying, if you always have mood symptoms together with psychotic features all the time, it means that you might be dealing with a depressive disorder with psychotic features or a bipolar mood disorder with psychotic features. So criterion B is very, very crucial. Very, very crucial, guys. Please make sure that you understand it. Make sure that you understand it. So let's move on to criterion or criteria C. So with C, in the duration of the entire illness, the more prominent, let me just change the marker there. So the more prominent symptoms should be that of whatever mood disorder it is. Like we said that It can either be a depressive or a manic. So look at this, guys. We said that there should be a time, a minimum of 2 weeks, whereby you have delusions or hallucinations in the absence of other moods of mood symptoms. But now see, saying that during the entire duration of the illness, you should have more of your mood symptoms than your psychotic symptoms. Psychotic symptoms that you only need the duration of 2 weeks only, a minimum of 2 weeks. So the other times, the more prominent symptoms should be that of mood disorder. I hope you guys will get that. I hope you guys will get that. So criterion D, as we all know that these symptoms should not be explained by a substance or some kind of medication. And also they must not be due to another medical condition. Another medical condition, right? So it's very important, guys. It's very important. I'm gonna just go through it again very fast. So we're saying schizoaffective is a condition whereby you've got a portion of psychosis and a portion of a mood. You've got a mood component. Criterion A says that for us to diagnose schizoaffective, we must meet criteria A of schizophrenia, which is 2 or more of these symptoms. One of those symptoms should be delusion or hallucination or disorganized speech. So, and the mood component can either be depressive or manic, right? Which means you can have someone who's got psychosis, symptoms of psychosis, plus mania. Or you can have someone who's got feature of psychosis plus a depressive episode. Number 2, criterion 2 says that in the entire duration of the symptoms of the illness, you should have 2 weeks whereby you've got either delusions or hallucinations in the absence of mood symptoms. And then you come to C. C says that, criterion C says that in the entire duration of the symptoms, the mood symptoms should be the ones that are more prominent. You only need about 2 weeks for delusions and hallucinations. Only 2 weeks. But the other times, which is the majority of the times, you should be having mood symptoms. D says that these symptoms should not be better explained by a substance, medication, or another medical condition. Right? Guys, there's the specifiers. There are those that we should know. There are those that are at a registrar level. So this one we should know. So when someone has got schizoaffective, we should specify if it's a depressive type. Meaning if it's if they've got schizo, the schizo part, we know it's psychosis, but the affective part or the affect part is a depressive. So we should say if it's a depressive type. And we should say if it's should also say if it's a bipolar type. So meaning mania in this case. Or also if there is catatonia. Catatonia is one condition that is confusing the people who formulated DSM-5. But anyway, we are going to talk about that later. Okay, guys, I think that's it with schizoaffective. Because I want us to cover a lot of conditions, so we're going to move on and do another condition now. I also want to go to mood disorders, and so that we can leave schizoaffective. But it's important to talk about substance and talk about yeah, let's just finish with it. Maybe probably when I get it, if I get a chance, I hope that I'll get a chance to do another video this afternoon, hopefully. Okay, thanks guys, bye.